we have Christina Dimakou from the European Union Agency for Fundamental Rights with us in person. We also have Dariana Gryaznova from Equality Now with us in person. And Bruno Monteiro of Validity is a Programs Director. And online, if all is well, I hope we have Elizabeth Schroeder joining us. This is confusing. We're not doing a break right now, definitely. So that's false news. But there's a QR code behind me that you can see that will take you to a participation survey. So later on, when we have a break, please do fill out our survey. But I think for now, we will start our first panel. And this panel is titled Gender and Disability-Based Violence in Institutions and Services. And I hope we can introduce today's focus on violence and abuse against women and girls with disabilities within and beyond institutional settings. We will look at recent findings on the prevalence of such violence, examine obstacles to access to justice, and set the stage basically for the rest of the day. So I'm very happy to welcome our speakers. And I'm sorry, could someone please confirm that Elizabeth is here? Okay, perfect. And if possible, we will start with Christina's presentation.
So I'm Christina Dimakou. I come from the European Union Agency for Fundamental Rights, FRA, and I am a second national expert. I'm working with FRA for the last 1.5 years. I'm working mainly on anti-racism, non-discrimination, disability, justice, and the rights of the children. So I promised Sophia that I will keep this short. I will try to keep that promise. So a very quick outline. I will talk about what FRA is and what FRA is doing on disability, on some relevant insights that we have on children and women with disabilities who are victims of violence, and our FRA project that is ongoing right now on fundamental rights protections of persons with disabilities living in institutions. See, I'm moving. So a few quick words about FRA's mandate and its role with regards to the rights of persons with disabilities. FRA, first of all, is an independent center of excellence that has been set up to promote and protect human rights in the EU. FRA engages legal and social experts who collect and analyze data and law, and consequently provide EU institutions and member states with evidence-based advice to help inform legislative processes, policies, and courses of action to address persistent fundamental rights concerns. So this is what we do in general. The EU Charter of Fundamental Rights prohibits discrimination on the ground of disability and recognizes the right of persons with disabilities to benefit from measures to ensure their independence, social occupational integration, and participation in the life of the community. The rights of persons with disabilities in the EU are also protected by the UN CRPD, in which the EU accepted in 2010, and it's the first time that the EU itself has accepted an international human rights treaty. So it's not binding only its individual member state, but the EU as a collective. As part of the EU framework to promote, protect, and monitor the implementation of the CRPD, FRA helps to ensure that the convention is implemented effectively and efficiently by the EU in its area of competence. FRA's work on the rights of persons with disabilities is framed by 3 principles, mainly the principle of self-determination, participation, and inclusion, as set out in the CRPD. FRA examines where legal and social barriers exist and identifies practices EU member states have introduced to empower people with disabilities. We also develop human rights indicators to show how member states are meeting their obligations under the CRPD. So that works better now. So here are a few selected reports, FRA reports on disability. We started back in 2012. With involuntary placement and involuntary treatment of persons with mental health problems. This report presented a legal analysis of international and national standards relating to those issues, and recounts also the experience of a small number of persons with mental health problems. This is the beauty of it. Instead of only staying in the legal standards and possible recommendations, we're having social field work. And we're actually talking to people on the ground. Well, not us, but the lucky people who are charged with interviews. This was followed by a report in 2013 on legal capacity of persons with intellectual disabilities and persons with mental health problems. In 2015, we focused very much on violence, and it was the first time to specifically address issues and extent of violence. And we published the report on violence against children with disabilities that I am going to present a bit further later on. And in 2017, we published 3 reports looking at different aspects of deinstitutionalization. You will please permit me to call this DI from now on. And independent living for persons with disabilities. So the first report of the...
More requests from our interpreters.
Thank you, it's fair enough.
It's okay, we can catch up in the lunch break. So we designed a day that we can accommodate 10.
I will slow down.
So it's perfectly fine.
So the DI reports. The first report presents the obligations that EU and member states have. The second report looks at something really important that is many times overlooked, how funding and budgeting structures can work to turn these commitments into reality. The third report, it completes the series by focusing on the impact these commitments and funds are having on the independence and inclusions of persons with disabilities in their daily lives and on these experiences. In 2018, I don't have it here, but if you go into our site, you'll definitely find it. They're linked. The perspectives from the ground were also published, and this is a very interesting publication. It's the human stories of the people who actually said how they experienced the DI process. In 2018, a guide was published to help independent national monitoring frameworks to fulfill their monitoring responsibility set out in Article 33 of the CRPD, and to help them design and improve indicators for assessing progress of the CRPD implementation in the national level. The report of violence against children with disabilities in institutions focused on 4 main things: the extent, causes, and consequences of violence against children, the settings, including but not limited to institutional ones, in which such violence occurs. It also examined legal and policy provisions that address violence against children with disabilities and national measures for preventing from and protecting against this violence. So this was desk research, the methodology, in 28 EU member states and 132 interviews with national bodies implementing the CRPD. The main findings: children with disabilities experience higher rates of violence as well as disability-specific forms of violence, which are different to those experienced by children without disabilities. So we have a vulnerable group with multiple or intersectional issues to handle. They include, so these instances, as we saw it through our research, included violence motivated by prejudice towards disability, restraint, sexual abuse during daily hygiene routines, violence in the course of treatment, as well as over-medication. This violence and its psychological consequences, I will add, devastate those children's lives. The importance of advancing the institutionalization by banning the placement of children in institutions and increasing family support measures to move to family-based care, especially for the younger children, was amongst the points that FRA strongly advocated for. Also, the need for strengthened, regular, independent, and well-resourced monitoring and cooperation between all actors was stressed in the FRA opinions. Moreover, EU and the member states were called upon to make sure that disaggregated data are collected. You will see this coming up. It's not there yet. So another interesting for this discussion, FRA product is the products on the surveys on violence against women. The first FRA survey was in 2012. It was the first of its kind on violence against women across the 28 member states. It was based on interviews with 42,000 women across the EU who were asked about their experience of physical, sexual, and psychological violence, including domestic violence. And complementary desk research was carrying out, covering the relevant legal frameworks in this 28 UMS. The survey results showed that women who have health problems or a disability indicate a higher prevalence of various forms of violence than women who do not have similar issues. It also showed that health problems and disability were, and the admittance of having them were actually linked to some extent to women's age. The prevalence of sexual violence during childhood was also brought forward by the participants themselves. In 2023, FRA, together with EIGE, the European Institute for Gender Equality, and in cooperation with Eurostat, carried out a second survey in 8 EU member states. The rest of the UMS are covered by Eurostat's EU GBV survey, gender-based violence survey. The FRA-EIGE survey collected data on experience on physical, sexual, and psychological violence, sexual harassment and stalking, and violence experienced during childhood. The survey also captures elements of online abuse. The key findings are actually going to be published next week on Monday. And the main report is going to be next year. The main report is going to be more analytical, also on intersections. So let's move to the project that we are running right now. First of all, what is this project? The objective is to examine how international and EU human rights obligations to prevent and respond to violence against persons with disabilities are applied in practice by each country in the development and provision of care in institutional settings. So in terms of where we are in comparison to what Edwin was presenting right before, we are looking at the stage before needing to access justice. We're looking at how people are treated during care, and we are looking at what we can do to either prevent and protect them from violence without needing to actually go to access justice. Not that we don't deal with access to justice. I will explain that later. The project aims both to underline the need to scale up the DI process, but also to provide practical recommendations on how to safeguard the rights of persons remaining in institutions while this process is still ongoing. I want to also say that it complements FRA's activities as part of the CRPD framework, as mentioned before, and there was a specific call from the EU disability strategy to examine this situation of persons with disabilities in relation to violence, abuse, and torture. Why? So right now, the institutional care seems to persist in the EU. We still have 1.5 million people still in institutions. The number hasn't substantially changed over the last 10 years, which is alarming, even though the DA process tried to move forward. And only a small number of people live in small-scale community-based services. Also, the number of children in residential care has slightly decreased, while persons with intellectual disabilities and complex needs are most likely to still live in institutional settings. We talked about how women have a higher possibility to face violence, how children do as well. Persons with disabilities are another category. Persons with disabilities in institutional settings also are particularly vulnerable because of their isolation, the power asymmetries, their lack of ability to seek outside help. Also, at the same time, we still lack sufficient research evidence on the experiences of persons with disabilities in institutions across the EU, and as a result, fundamental rights issues affecting those living in institutions remain largely undocumented. So how we did this? Desk research was carried out in all 27 member states, including also the FRA observer countries, which are Albania, Serbia, and North Macedonia. The core areas explored were legal and policy frameworks, including accreditation standards, care, case law, and drivers for change. Monitoring carried out by public regulatory bodies and independent bodies. The availability and function of formal, informal, and independent complaints mechanisms. And victim support in terms of cooperation between competent actors and access to information and specialized services. The second part of our research is fieldwork research conducted between April and September this year. We have received and reviewed 143 interviews in total, 13 to 15 from each country. The 4 categories of stakeholders that were being interviewed are policymakers, national and local governmental officials, public officials responsible for institutional services. The second group are practitioners, managers and employees of institutions actually responsible for providing the care. The third groups were national human rights bodies and civil society organizations, including victim support organizations, representatives, and representative organizations. And the fourth group, persons with disabilities who have been victims of violence or have not been victims of violence, but have been or currently reside in institutions. What we want to do with the fieldwork is twofold. First, to gather information directly from the people that have practical experience with relevant actors and service providers, and from those who are involved in the planning and development of national policies addressing violence against persons with disabilities in institutions. This way we can better map gaps and challenges and assess the effectiveness of existing instruments, but also to identify possible ways forward or promising practices to share through our report next year. Secondly, the interviews with persons with disabilities will hopefully help to anchor the overall analysis and report outcomes to the lived experiences of persons with disabilities in institutions and let their views, needs, and stories be actually heard. We have some additional activities which are quite interesting. We cooperated with the European Network for Victims' Rights with the SIDE research. The information collected through this survey will complement the data gathered by FRANET Desk Research, and the added value is that it focused to access to protection and support for victims of violence that was not covered in detail by the FRANET, our contractors' desktop research. We have, of course, our in-house research, capitalizing on previous extensive research, and I would call upon you to read also the 2023 skim through the report on EU funds on ensuring compliance with fundamental rights. All the national reports are available online, and you can find much more information and challenges and opportunities with regard to fundamental rights in the implementation of EU funds. And we have ongoing stakeholder engagement, but I will move on because I think there are more important things to share. The results will feed into several processes, including the Victims' Rights Directive revision, the EU Disability Strategy, the EU framework for monitoring the convention, the EU funds, as I mentioned, a lot of UN strategies, processes and guidelines, and also a lot of Council of Europe instruments. Some general comments before thanking you. We cannot share findings as per se from our research because the report is not yet out and we're still analyzing the data. But I have some general comments and observations on what we found and on specific things for women and children. The first comment would be that we're faced with a rather patchy picture. Most of the provisions and measures are not specifically tailored to persons with disabilities in institutions, and multiple vulnerabilities or intersectionalities are not taken into account in law and policy. The information provided refers mostly to provisions and measures targeting either the general population of victims or victims with disabilities, and most of them are not specifically tailored to those residing in institutions. A few practices and measures developed for and targeting the latter group were also identified, albeit not many. What we saw is that victims with disabilities in institutions fall between the cracks of protection systems in place and sometimes face multiple vulnerabilities that are not effectively addressed. When it comes to national frameworks and especially regulation in law, what is missing is definitions. It's categorization of concepts. What is an institution? What is violence against persons with disabilities? We should not forget also that for the EU, it's very difficult to impose horizontal rules, especially bearing in mind that according to the treaties, competence on social policies remains mainly with the member states. This also explains what we're facing now in law. In terms of public monitoring, we're seeing diverse approaches, but generally there is a social or healthcare inspection body which will monitor compliance with quality or accreditation standards. What was surprising that not in all cases the scope of public monitoring or the standards in place explicitly address in their oversight activities issues related to fundamental rights, compliance, abuse or violence. This makes independent monitoring even more pertinent. On the other hand, independent monitoring is almost exclusively done by the national preventive mechanisms. With few exceptions, only 3 MS bodies are focused specifically in institutions for persons with disabilities. And there is apparently, in this case, a focus on detention and the traditional, the usual suspects, as Zofia said before, the psychiatric facilities. We see also in the Council of Europe's work that slowly we're moving also towards monitoring social care facilities, but it is the last component. And due to the lack of resources in the national level of the monitoring bodies, this is very usually overseen. Complaints mechanisms are mainly handled by ombuds institutions. There are not many examples of facilitated reporting mechanisms or other schemes in place that would make reporting or complaints more accessible for persons with disabilities residing in institutions. Especially the second part of what Edwin mentioned before, not reporting to the authorities, but other pathways, third-party reporting, reporting to someone to complain and express what you feel so that you can be advised on how to report to the authorities. And of course, what was a little bit disappointing for me, but not surprising for many of my colleagues, there's no cooperation on referral mechanisms and special support for victims. In terms of engagement with civil society and DPOs, we see few good examples, but they are more the exception than the rule. And there isn't much involvement of CSOs and DPOs, the representative organizations, in monitoring or decision-making processes, while it seems that the monitoring mechanisms, mandates, would allow for this. We have very few information that is related to data collection, disaggregated either by age or gender. The problem lies in the fact that there is no national monitoring and data collection processes that take into account the institutionalization also of those people. In no case that I can recall at least, any of the MS complaints mechanisms could provide for data disaggregation on the basis of persons placed in institutions or on the kind of violence endured. Even disaggregation by age and gender is difficult to get, while most countries just reported that the publicly available data on complaints are only on complaints received, complaints handled basis. So we actually don't know what's happening. A few observations in relation to gender and age, and I'm wrapping this up. We see, and what we got especially from field work, is that there is increased vulnerability of women and children with disabilities in institutions. Especially there is a lack of awareness of what constitutes violence. I recall this, that I read in one of the interviews that a woman went back to her mother after having been raped in a healthcare institution, and from a healthcare provider, and she called herself stupid for letting this happen to her. So she knew it was violence, but she thought she was to blame. In other cases, that because we're talking about persons in institutions, we are talking about heavy cases. We're talking about people with psychosocial disabilities that do not actually understand that caressing them while bathing them, it's sexual exploitation or harassment. There is a huge need for training of professionals responsible for the provision of care. We saw that, and was a recommendation coming up from many of the practitioners in the field and the national policymakers. And from the victims, what we saw also was that they are afraid to report, something that we know from other research on victims' rights, which is very extensive. I just thought we don't have time to go into this. In FRA's side, you can find a lot of it. But the risk of re-victimization is there. It's a key factor to underreporting, along with the lack of trust to the authorities and of lack of trust what will happen to them after they report, because in most countries, the authorities can't actually take the victim and place them somewhere else after they report. So they are, until this process is resolved, because it needs time, they are just there with their perpetrators. So the risk of victimization, what we see, is increased when the victim faced early age violence. And this is something that comes back in many interviews, that the victims faced violence when they were children. To conclude, 2 sentences. So considering the gravity of those violations, their increased vulnerability of the persons involved and the protection risks, this is not a positive picture and alludes to out of sight, out of mind approaches of the past for persons with disabilities and institutionalized persons. The need for deinstitutionalization is more pressing than ever, and so is the need to immediately reinforce these groups' protection and safeguards, not only in theory, but also in practice. I don't want to be grim, and I don't want to close with letting you believe that nothing changed. There are a lot of things that change, especially for children there, and with a child guarantee in Europe, there has been progress. The few cooperation mechanisms that we found, the few multifaceted approaches for monitoring and for complaints are actually mainly for children. But this doesn't mean that we don't have other persons with disabilities, with other kinds of vulnerabilities that need our attention. Thank you.
Thank you so much, Christina. I thought it was very interesting how you not only made some spoilers for our next sessions, but you also echoed our disconnected national reports, the research we carried out within the Disconnected project. I think many of the things you mentioned, especially not recognizing violence, missing data, the risk of re-victimization and the need for deinstitutionalization to happen are also there. Of course, our research was much, much smaller scale, but still, I thought it was very interesting. And then our next sessions will also address independent monitoring, legislation reform, and then providing other pathways of reaching victim support services. So I think we're managing to set the stage absolutely for our today. And now we will move on to our next speaker, Dariana Gryaznova, I'm so sorry, from Equality Now. I know I might have butchered your name. Dariana, the floor is yours.
Thank you very much. Honestly, I have so much to share with you and to reflect on, but I will try to keep my presentation short. Thank you very much, Christina, for your important presentation on data collection and research. Indeed, data collection and research are key when it comes to addressing the issue of gender-based violence, violence against children, especially with disabilities. So, as I will mention a little bit later, at Equality Now, we recently submitted a report to the CRPD on Azerbaijan. And can you imagine, Azerbaijan reported only 13 convictions of sexual violence against women and girls with disabilities over 4 years. So we cannot say that there were only 13 incidents of sexual violence in Azerbaijan over like 4 years. So my name is Dariana Gryaznova. I'm a Eurasia legal advisor at Equality Now. Equality Now is an international human rights organization working on protection and promotion of the rights of women and girls since 1992. We have 4 thematic areas: ending sexual violence, ending sexual exploitation, ending harmful practices, and access to justice. So I'm a Eurasia legal advisor. I work mostly with our partners from the former Soviet Union countries. And when I will talk about our work, I will use examples from the former Soviet Union countries. Where is this magic tool? I think not. Yeah. Just can you teach me? Yes. So as an international organization, we work in the following formats. So we produce and release reports for wider audience. So, for example, in 2023, we released a report on sexual violence and disability in Kyrgyzstan. And currently, we are developing the report on sexual violence against women and girls with disabilities in Central Asia, broadly covering the situation in Kyrgyzstan, Kazakhstan, and Uzbekistan. And fingers crossed that it will be published soon. Also, we have an online webpage on navigating the justice system as a sexual violence survivor with disabilities. We have more information on what's going on around the globe when it comes to sexual violence against women and girls with disabilities. Also, we submit a lot of alternative reports to regional and international mechanisms. On the slide, you can see the list of those mechanisms, and it's not only usual suspects, CEDAW and CRPD, but also we raise issues of sexual violence against women, girls, and disabilities before Committee Against Torture. And before the Committee Against Torture, we raised the issue of national preventive mechanisms and monitoring of closed institutions and care facilities. Also, CRC commissioned the status of women, and also we raised universal periodic review, and we raised the issue of violence against women and girls with disabilities at EU human rights dialogues. And I think all slides will be available to the participants later, and you will have a QR code on all our work. So when it comes to barriers to justice in sexual violence cases, these are non-disability specific challenges, but if a survivor has a disability, these barriers are exacerbated and compounded, making access to justice for women, girls, and disabilities even more difficult. So, as Christina have already mentioned, sexual violence remains significantly underreported for various reasons. Sometimes it is lack of knowledge. Sometimes it's distrust in the criminal justice system. Then when it comes to Eurasia, former Soviet Union countries, unfortunately, there is a lack of consent-based definition of rape. So in accordance with international standards, the definition of rape should be based on the lack of free and voluntarily consent, taking into account all surrounding circumstances. Unfortunately, in the countries where Equality Now works, definition of rape is based on either violence, threat of violence, or using so-called helpless state of the victim. But unfortunately, these provisions are very conservatively and narrowly interpreted by authorities, law enforcement authorities, and it results that these provisions fail to specify the broad range of coercive circumstances under which rape or other forms of sexual violence can be committed, as recommended by international standards. So just to translate it from legal English to normal English. So for example, if there is a person with a woman with disabilities who depends on her caregiver, and this caregiver just says her either we do this or I will place you, for example, in this institution, or I will deprive you from necessary support, in this case, in accordance with legislation of countries where we work on. These actions won't be classified as rape, although they have to be classified as rape in accordance with international standards. So it means that many victims of sexual violence they cannot get access to justice. Then, of course, there are burdensome and discriminatory evidentiary standards which continue to persist. Survivors face a severe lack of support services. That's what Christina mentioned as well. And you mentioned in the presentation that in some jurisdictions, a victim cannot be taken from this abusive environment. We have another problem, for example, like in Kyrgyzstan, in Uzbekistan, and in other countries where we work on. Even if a victim can be taken from this, for example, abusive family or institution, there is no other place where she can live. So at Equality Now, we currently work on one strategic case on sexual violence against a young woman with disability. She was sexually abused by her grandfather and uncle. And of course, she was taken from her abusive home and placed at NGO, but we should understand that capacities of NGOs, they are very limited, and they cannot just simply accommodate needs and provide accommodation for all survivors. So this is a huge barrier when it comes to support services. And of course, there are deeply entrenched patriarchal attitudes, gender stereotypes, and even humiliation from law enforcement authorities and forensic experts. Victim blaming by law enforcement authorities, relatives, and communities, which prevent victims from reporting. So yes, as everybody has told already, there is a lack of mechanisms to identify and monitor women and girls with disabilities at risk. So there is lack of an effective system to identify, monitor, and assist women and girls with disabilities, especially when it comes to women and girls in psychiatric and psychoneurological institution, care facilities, and other places without effective control. And because they usually survivors, women and girls there, they do not know how to report abuse. Sometimes there are not even available mechanisms, or sometimes they just are afraid of reporting because of power imbalances. So we, in our work at Equality Now, so there was one case, a woman with social psychological disabilities. She was raped by a neighbor, and unfortunately, this sexual violence was uncovered and discovered only when she was pregnant, on 6 months of her pregnancy. Another case, a young woman was sexually abused, and she, although by her relatives, and although there were these formal and official visits from authorities, those visits were very superficial. And so basically, this person from this social worker just ticked the box that a woman was there, and she was relatively fine. So a social worker wasn't equipped and trained to identify signs of abuse and how to ask certain questions to identify, to be able to identify this abuse. Of course, I mentioned that there are these gender stereotypes, and unfortunately, in countries where we work, the medical model of disability persists, unfortunately, and women and girls with disabilities are often perceived as sick and needing treatment, unfortunately. And there are these, when it comes to sexual violence cases, unfortunately, there are these stereotypes about sexuality of women with disabilities, and all these horrible quotes which are provided on the slide, they are from our local partners who represent survivors with disabilities. So survivors with disabilities either perceived as asexual or hypersexual, or those who should be grateful for attention from sexual attention from a man, unfortunately. And of course, there are burdensome and discriminatory evidentiary standards. So in the overwhelming majority of cases, sexual violence crimes are prosecuted only when physical injuries are found on the body of victim, as well as biological material associated with the sexual act. We know that quite often survivors with disabilities, especially those who are placed at who live at institutions, they do not report abuse immediately, and often it results in lack of, even if there were injuries or biological material, by the time a victim reports this case, there are no signs of violence and biological material. And what happens? So a victim reports, and the authorities conduct this forensic examination. And if it doesn't identify injuries on the victim's body, so the case is dismissed. And when it comes to survivors with disabilities, the victim's testimony, especially if she has a mental disability, may not be believed. And another problem is mandatory appointment of psychiatric or psychological expert examination. That's what we come across working in our region. So basically, an investigator just appoints this psychological or psychiatric examination. And in reality, it is conducted to assess women's supposed competency in order to determine if her testimony can be considered so-called reliable. If deemed unreliable, the survivor's account is automatically discounted, which leads to the dismissal of the case. And on the slide, you can see provision of the criminal code of Azerbaijan, criminal procedure code of Azerbaijan. It says that appointment of this examination, psychological psychiatric examination, is mandatory, and that if a survivor cannot correctly perceive or recount the circumstances, so she cannot be questioned as witness. Before I go to our key recommendations, I would like to highlight other investigative failures. So, for example, in the case we, Equality Now, currently litigate together with our partners in Kyrgyzstan, authorities were aware of the survivor's disability from the outset. However, no measures were taken to accommodate her specific needs or ensure her meaningful participation in the process. So, for example, even how communication with this survivor was handled. So, for example, despite knowing that the survivor didn't understand certain terminology, the investigator repeatedly used inaccessible and technical language. So, for example, I read this transcript of her interview. And for example, the investigator asked, do you know what is hymen? Do you know what is contraceptives? Do you know what is rape? And the survivor repeatedly said no. And then he continued to use this terminology, like asking her to clarify on the circumstances of the case. And in that particular case, it was actually funny. So I mentioned this problem with psychiatric and psychological examinations. And in our case, a woman kind of passed this test. So an expert psychologist found that she could provide testimony, that she couldn't resist her relatives' actions, and that, I'm quoting, she didn't demonstrate a tendency to fantasize. So it's like a thing they keep asking whether this person with disability is fantasized. And even though our woman, she just passed this test, unfortunately the case was just terminated because forensic medical examination didn't find any signs of violence. Although, like, I think several months or several years passed since that episode. In the terms of recommendations, so I am wrapping up. Our key recommendations, which we list in our reports for a wider audience, in alternative reports for human rights mechanisms. So we ask to amend the definition of rape. So it is based on the lack of consent, and that guides, victim-centered guidelines on how consent should be understood, including in relation to survivors with disabilities. Like, these guidelines should be adopted. Also, what we have here on the slide, yes, authorities should in place comprehensive manuals and guidelines in line with CRPD and CEDAW standards, and provide training for not only law enforcement authorities, but all people, like social workers, like teachers, to be able to identify signs of abuse and handle this correctly. And also, of course, victim support services should be established, and women and girls with disabilities should be provided reasonable and procedural accommodations. All these recommendations on removing burdensome and discriminatory evidentiary standards, on data collection, and on comprehensive strategy how to tackle sexual violence against women and girls with disabilities. And what we do, so we of course advocate for domestic legal reforms. So, for example, when we receive recommendations from UN treaty bodies, of course, we don't stop there. We write letters to authorities asking to implement those recommendations. So, for example, that's what we did with Azerbaijan, that's what we did with Tajikistan, that's what we did with Kyrgyzstan and other countries within our region. So we also advocate for changes in practice. In particular, currently we work closely with authorities in Kyrgyzstan, and we are trying to develop a mandatory manual for practitioners in Kyrgyzstan how to effectively investigate, prosecute, and adjudicate sexual violence cases, with a particular focus on survivors with disabilities. And we want, it is a bit lengthy process, because we don't want to just release this manual. We want this manual to be developed in collaboration with authorities to ensure that this manual will become mandatory for law enforcement authorities and other practitioners. And we do the same with the Bar Association of Kyrgyzstan to develop mandatory trainings for lawyers, how to effectively represent survivors of sexual violence, including those with disabilities. And we try to contribute to global change. So, unfortunately, when we started to draft this manual on effectively prosecuting and adjudicating sexual violence cases against women and girls with disabilities, we found that the intersection of sexual violence and disability with criminal justice process, unfortunately, is a much neglected area. And, for example, in September 2024, we gathered an expert meeting to address violence against women and girls, mostly women with disabilities. And you can see a photo from this event. And colleagues from Validity also were there. And we addressed these issues of consent in relation to survivors with disabilities, legal capacity issues, and I know that we have a speaker who will talk more about legal capacity, which is great, and other relevant approaches. And even in April 2024, we submitted a joint letter to the CEDAW committee proposing a general recommendation on access to justice for women and girls with disabilities. So fingers crossed that it will be developed. So thank you very much for your attention. You can see my email address, and I will be happy, if you have any questions or ideas for collaboration. Thank you very much.
Thank you so much. Yeah, it's been really lovely to see some of our colleagues on the photo, and many of the things you mentioned, we know some of our own litigation cases. So, and I understand it's one of the hardest cases to litigate, the area that you talked about. Thank you. And our next speaker is going to be Elizabeth Schroeder from Women Enabled International. Hi, Elizabeth. I see that you are with us online, so I will give you the floor.
Thank you so much. As you just said, my name is Elizabeth Schroeder, and I'm here with Women Enabled International, or WEI. For anyone who's not familiar, WEI is an organization of feminists with disabilities and allies working to advance human rights and justice at the intersection of gender and disability, to challenge exclusionary, unjust systems, and to support the leadership and center the voices of women, girls, and gender diverse people with disabilities globally. With WEI, I'm currently working on a global research project regarding the intersection of the right to legal capacity and sexual and reproductive health and rights for women and gender diverse people with intellectual and psychosocial disabilities. This project is in response to the calls by activists with intellectual and psychosocial disabilities on the impact and urgency of this matter, and it's taking place across 5 countries, including one in Europe, and that's Spain. This project was developed in collaboration with local organizations of people with intellectual disabilities and psychosocial disabilities, as well as Inclusion International and TCI Global. And this research is comprised of both desk research and focus groups and interviews of women and gender diverse people with intellectual and psychosocial disabilities, which were facilitated by women with intellectual and psychosocial disabilities. I'm grateful to be here for this important conversation. Thank you for having me. An agenda for our brief time together here today. First, I will provide a very brief overview of the right to legal capacity, as I'm sure many, if not all of you, are familiar with this essential right. Then I'll describe generally how denials of the right to legal capacity intersect with institutionalization, sexual and reproductive health and rights, gender-based violence, and access to justice. And then I will share some of the early findings of the research that was conducted in Spain. So to begin, the right to legal capacity, as many of you know, this right is codified in CRPD Article 12, and the scope of this right has been clarified by the CRPD Committee in its general comment number 1, which is there on the screen. Many explain the right to legal capacity, as in particular the second strand of the right to legal capacity, as the right to make decisions and to have those decisions respected. Unfortunately, these rights are denied to people with disabilities and disproportionately women and gender diverse people with intellectual and psychosocial disabilities through both formal and informal practices. Formal practices would be through regimes like guardianship, wherein a court grants someone the legal authority to make decisions for an individual. And informal practices, sometimes referred to as de facto guardianship, occur when someone does not have the legal authority to make decisions for an individual, but nonetheless does so. And this can occur with family members, healthcare professionals, service providers, etc. The right to legal capacity intersects with a whole host of fundamental human rights issues, including institutionalization. And I want to highlight 2 intersecting impacts on this front. The first is that denials of legal capacity both, and this is a quote from a report of the Special Rapporteur on the Rights of Persons with Disabilities, perpetuate discrimination and exclusion against persons with disabilities and pave the way to different forms of abuse, corruption, exploitation, coercion, and institutionalization. And then once institutionalized, as has been discussed here today already, women and gender diverse people with disabilities are at higher risk of having their legal capacity denied. These denials are frequently felt in the areas of sexual and reproductive health and rights and gender-based violence. As was written in the 2022 CRPD guidelines on deinstitutionalization, women with disabilities are at heightened risk of violence, exploitation, and abuse compared with other women, and of GBV and harmful practices, such as forced contraception, forced abortion, and sterilization during institutionalization. I think it's essential to note here as well, and I say this in particular with the United States in mind, where focus groups just concluded as a part of this research as well, that in predominantly white and global North countries, interpersonal and systemic racism have for centuries exacerbated and continue to exacerbate the situation for women with disabilities of color, in particular for Indigenous women and those of African descent. Forced, coerced, and involuntary sterilization, abortion, and contraception are just one way in which legal capacity and sexual and reproductive health and rights intersect. But I felt it was particularly pertinent to this conversation on violence because, as the Special Rapporteur on torture and other cruel, inhuman, or degrading treatment or punishment has framed it, forced sterilization is an act of violence. As for legal capacity and other forms of gender-based violence, as has been discussed by other panelists, denials of legal capacity can impact both the prevalence and risk of gender-based violence, as well as limit access to justice for and healing from gender-based violence, exacerbating cycles of violence, which I will discuss in more detail next. There are many ways in which legal capacity, institutionalization, and access to justice intersect, including making it much harder to report gender-based violence. Even if people do manage to report, laws can strip people of the capacity to either initiate legal proceedings or to testify in them. And even if those barriers are overcome, these cases are dependent on witness credibility and pervasive ableist and misogynistic beliefs about the credibility of women and gender diverse people with disabilities, as well as racist beliefs about the credibility of people with disabilities of color. All of those things make succeeding in these cases very difficult. So as a result, the cases of many women and gender diverse people with intellectual and psychosocial disabilities will either never come in front of a judge or jury or tribunal, or won't succeed, fueling the ableist and misogynistic beliefs and the gender-based violence cycles that follow, that their stories are not to be heard and their experiences not to be believed. Now, I would like to share some of the early findings from the research in Spain that are related to the conversation we're having here today. Again, this is the result of focus groups of women with intellectual disabilities that were facilitated by women with intellectual disabilities. These women with intellectual disabilities spoke to first the deep impact of institutionalization. Participants spoke to how institutionalization hinders the access of women with intellectual disabilities to decision-making, as the right to even basic day-to-day decisions, such as with whom to live, whether to share a room, choosing if they'd like to bring a sexual or romantic partner home, is taken from them. And it can also strip them, formally or informally, the right to make decisions related to serious issues, such as the reporting of gender-based violence. The second is the inextricable links between sexual and reproductive health and rights and gender-based violence. SRHR and GBV are closely connected in the lived experiences of these participants. For many, strikingly and sadly, their first experience seeing a gynecologist or accessing family planning services was after experiencing sexual abuse. And finally, the effect of harmful stereotypes on credibility has, as other panelists have spoken to as well. And I should note, while the research didn't focus on access to justice, these conclusions can be drawn based on the findings of the focus groups, the early findings of the focus groups. And that is that the experience of these participants mirror, unfortunately, what I was just discussing and what we've discussed here today so far, that when experiencing gender-based violence and seeking help for or reporting the violence, women with intellectual disabilities have their credibility questioned. This is grounded in harmful stereotypes about them, which lead those that they report to, including formal legal systems, to perceive their experiences as inconsistent or false. So these are some of the key reflections, early key reflections and takeaways of this research that was done in Spain as a part of this larger global project on the intersection of legal capacity and sexual and reproductive health and rights. And they are representative of the kinds of findings that will be documented in the research report once it is published in mid-2025.
Thank you so much, Elizabeth, and thank you for bringing in the legal capacity aspect. It's very, very important. And our next speaker is going to be one of my colleagues from Validity, Bruno Monteiro. Bruno, the floor is yours.
Thank you, everyone. Hope everyone can hear me and see the slides. Great. Just before starting, I'd like to say thanks to absolutely all partners and also the team at Validity that conducted the research as part of Disconnected. It was all thanks to your work that we're able to share more the voices of multiple women and children who were subjected to different and multiple types of violence. Some violence that started as children and then continue on as adults, unfortunately. And a lot of our findings actually reinforce what has already been found in FRA's survey, but also echo what's happening in other continents, as Dariana and Elizabeth has shared. Just very briefly to give you an idea, so Validity has multiple projects on access to justice. I'd like to mention briefly when it comes to access to justice for women with disabilities, we have one which has finished recently, focused on defendants with intellectual and psychosocial disabilities. You can read this in this report on Validity's website, but of course the PowerPoint will be shared with everyone, and which has a specific section on experience of women as defendants and their experience in the justice system. But of course, here I'm going to focus more specifically on the findings of Disconnected project here, which is the experience of women who either reside in institutions or were subjected to domestic violence in their homes, and share a little bit of their stories. Especially because some stories of their experience as children then help shape their experience as well as adults, and then it's important to mention this as well. My experience, my presentation will focus on two particular matters, which more on legal capacity and independent living, and how guardianship and institutionalization affected or had an impact, generally negative impact, of how women were able to access justice whenever violence happened in their homes or within institutions. The Disconnected project has a particular advantage, even though it covers 5 countries. And I know partners later on in later sessions will talk a bit more about their experiences. 5 countries were Bulgaria, Hungary, Slovakia, Lithuania, and Portugal. Then it covered experiences covering from all these areas, which also include residential institutions and psychiatric institutions as well. All this is give a helpful context, but the main point of it is actually just to reflect more on the experiences of women, and to give a bit more visibility to their voices and what they went through. As you can imagine, and as you heard from other panelists, women with intellectual psychosocial disabilities go through, have to overcome different barriers throughout their life. These quotes already help to illustrate some of it, just to read them a bit. A quote from a Bulgarian woman with intellectual disabilities: "When I started mentioning the sexual violence, I don't think they really believed me. They think that everything is caused by the psychosis." Another quote from a Hungarian woman: "Being a woman and having an intellectual disability feels like a double disadvantage. My peers are often taken advantage because they have no sexual education and don't understand what's happening to their bodies." Another quote from a Portuguese woman: "When she attempted to file a complaint to the police, they call her crazy." Now, I'm not going to go into detail because I believe Elizabeth did a wonderful job explaining what legal capacity is. But the main points to take away from this is how the lack of legal capacity can actually affect how women can access justice proceedings. It affects on how whether if they have the power to make a criminal complaint autonomously, affects how they can make decisions about their case, whether if they have to always go through their lawyer, family, or even service providers sometimes, and make decisions about the support they want and the kind of adjustments are appropriate in justice proceedings. The main thing which should always happen for women and children to have access to justice is for there to be for decision making to be supported, for there to be access to supported decision making measures, which unfortunately, as I will show, this doesn't tend to happen much. In 5 countries, at least 4, there still guardianship laws still exist. And in Portugal, guardianship was formally repealed, which is great. Although I still find it a bit strange how access to support decision-making measures still requires person to be, well, at least to be able to show they cannot really govern themselves, which kind of puts them in a bit awkward situation, where it's not really their view, it's still a judge deciding what is best for them. Now, and here it was mentioned already by the other panelists that guardianship, especially and this came out especially in Bulgaria and Hungary, that is still viewed as a form of protection. And here, now this, of course, this is not exactly the case. And here is a quote that helped illustrate this in Bulgaria. After he was discharged, here we're talking about a child from a hospital. They put him under guardianship. His mother became the guardian, the one who neglected him. He remained in extreme dependency, and the support workers could do very little to support the actual person without going through the mother. And as mentioned, we found plenty of examples where justice and legal professionals, as soon as they found that a woman is under guardianship, they prefer to communicate to either to the guardian, or in case of an institution, they prefer to talk to the staff working there. There's some examples in Bulgaria, Hungary, in Lithuania on this. And there's also different examples of, again, they cannot make a complaint without the guardian, and there are even some examples in Slovakia where because there was a guardian in place, any request to the court, especially on compensation, then required to be made by the guardian. So the victim itself cannot do it. Then this is all on legal capacity, just to give you a sense on how guardianship already affects access to justice. Now, focusing a bit on independent living, because as you know, and a right established in the UN CRPD, all persons with disabilities have the right to live in a community and choose where they want to live, and where, with whom, and have access to support to live independently. In reality, this tends not to happen, especially with the types of disability where it's considered needs to be more complex. What happens in reality then, several member states tend to opt to and see that as a support protective measure, putting them in placing them in institutions, which under the DI guidelines on deinstitutionalization they're discriminatory. They lead to de facto denial of legal capacity and constitutes detention and deprivation of liberty. And of course, and here in the next slide, I'm going to show a little bit on how important the process of DI is to actually to enable more victims within the institution to have access to justice. Just one very briefly, of course, in these 5 countries, is still pretty much an established practice, placement of persons with disabilities in institutions, including small group homes. And there's also examples of, and which identified within the project, where victims of gender-based violence, then as a form of support, then they were, it's pretty much seen as a form of support and protection for the victims themselves. The idea is, as long as they're in the institution, then the presumption or assumption is they're safe there. And this happens also especially with children in cases of domestic violence. I think in Bulgaria, this was especially prevalent where there was a case of domestic violence. I remember there was a case mentioned in Lithuania as well, where women mentioned how terrified they were when they heard as children, heard their parents being threatened, and also mentioned to the child as well that, okay, if you continue their behavior, we're removing your child from you, and we're going to place the child into an institution. Which is, of course, terrifying. Now, how it affects more explicitly access to justice. We found that institutions, a particular environment creates an environment of dependency on the guardians and the personnel working there to access any form of support. I think this quote here from Hungary is particularly telling, which I'm going to read out. It's a very strong dependency situation. They're more afraid of the uncertainty of, if I report and say I'm out of this family or I'm out of the institution, what's in store for me? Or they are afraid of retaliation. So their victims are always faced with a situation where they don't feel like they have a viable option to leave the situation. And to quickly wrap up, and to help with the timekeeping as well. Also, there are different examples of self-monitoring, which happens in closed institutions, is inadequate and doesn't actually address the violence that happens in it. A quote from Slovakia: "There is cigarette coffee bullying. We try to make it work somehow, but they can't defend themselves, and we can't go to every client." And you can imagine, especially for institutions that are very large, and few resources, it's humanly impossible for within it to be able to protect from violence and be able to actually even give the support they need. Another example, but here I invite us to also visit the Validity website, where a case that we won recently, the European Court of Human Rights, which shows a particular horrible situations that can exist in closed institutions, and where the lack of action of guardians then have who completely neglected women and children inside. In this case, Ms. TJ has actually led to her death. Now, just quickly for some recommendations. I'm not going to read everything out, but give a very brief summary, especially because these recommendations came from women with disabilities, and here is. Especially for victims who have access to justice, procedural accommodations are needed. These need to be individualized. And here's an example. I mentioned how a woman, how was appreciated during the questioning that she was able to bring her own therapist for she felt to have the support she needed during the questioning. The other is respectful treatment and active listening. I've never had that in my life. The problem is knowing how to listen, knowing how to understand, which makes a big difference, especially during a reporting stage. There are a lot of measures that could be helpful to have access to justice. I know speakers in the next sessions will talk about it more in length, so I'll go into details. And of course, all of these reports are available online. Currently at Validity website, and we'll be happy to share more synthesis over the next coming months by February. Thank you so much for listening.